1. According to the National Phlebotomy Association, NPA standards, what is the maximum number of venipuncture attempts a phlebotomist should make on a single patient before seeking assistance? 1 attempt, B2 attempts, C3 attempts, D4 attempts. 2. When performing venipuncture using the evacuated tube system, what is the correct order of draw for the following tubes? Light blue, sodium citrate; red, no additive; lavender; and green, heparin. A. Red, light blue, green, lavender. B. Light blue, red, green, lavender. C. Lavender, green, red, light blue. D. Green, lavender, light blue, red. 3. What is the primary reason for inverting blood collection tubes immediately after collection? A. To prevent hemolysis of the specimen. B. To mix the blood with the additive and prevent clotting. C. To allow air bubbles to escape from the tube. To verify the proper fill level of the tube. 4. According to OSHA bloodborne pathogens standard, what is the required action if a phlebotomist experiences a needle stick injury? A. Complete an incident report within 7 days. B. Immediately wash the area with soap and water and report to supervisor. C. Apply bandage and continue working to complete the shift. D. Dispose of the needle and document in personal log. 5. Which of the following veins is considered the first choice for routine venipuncture in adults? Basilic vein, cephalic vein, C-median cubital vein, dorsal hand vein. 6. When teaching adult learners about phlebotomy procedures, which instructional approach is most effective according to adult learning theory? A. Lecture-only format with detailed PowerPoint presentations. B. Hands-on practice with immediate feedback and real-world scenarios. C. Reading assignments followed by written examinations. D. Observation of procedures without active participation. 7. What is the recommended angle of needle insertion for routine venipuncture? A. 5 to 10 degrees. B. 15 to 30 degrees. C. 45 to 60 degrees. D. 90 degrees. 8. According to NPA standards, how long should a tourniquet remain on a patient's arm during venipuncture? A. No more than 30 seconds. B. No more than 1 minute. C. No more than 2 minutes. D. No time limit if patient is comfortable. 9. Which additive is found in a light blue top tube and what is its primary function? A. EDT anticoagulant for hematology testing. B. Sodium citrate anticoagulant for coagulation testing. C. Heparin anticoagulant for chemistry testing. D. Sodium fluoride glucose preservative. 10. What is the minimum acceptable identification method for a patient before performing phlebotomy? A. Asking patient to state their name only. B. Checking the room number and bed assignment. C. Asking patient to state full name and date of birth, then verifying with wristband. D. Verifying with family member present in the room. 11. When evaluating a phlebotomy student's competency, which assessment method provides the most comprehensive evaluation? A. Written multiple choice examination only. B. Direct observation of technique with competency checklist. C. Self-assessment questionnaire. D. Peer evaluation without instructor oversight. 12. What is the appropriate action if a phlebotomist notices that a collected blood specimen has hemolyzed? A. Submit the specimen with a note about hemolysis. B. Recollect the specimen and document the reason. C. Centrifuge the specimen immediately to separate components. Store the specimen at room temperature and recheck in 1 hour. 13. According to the Clinical and Laboratory Standards Institute, CLSI, what is the recommended needle gauge for routine adult venipuncture? A. 18-19 gauge. B. 20-22 gauge. C. 23-25 gauge. 26-27 gauge. 14. In curriculum development for phlebotomy training programs, What is the minimum number of successful venipunctures typically required for entry-level competency? A. 10 to 25 successful venipunctures. B. 30 to 50 successful venipunctures. C. 75 to 100 successful venipunctures. D. 150 to 200 successful venipunctures. 15. What is the correct procedure for disposing of a used needle immediately after venipuncture? A. Recap the needle using both hands, then dispose in sharps container. B. Place uncapped needle directly into sharps container without recapping. C. Break the needle from the syringe and dispose separately. D. Recap using one-handed scoop technique, then dispose in sharps container. 16. Which of the following is a contraindication for performing venipuncture on a specific arm? A. Presence of tattoos on the arm. B. Patient preference for the other arm. C. Mastectomy on the same side as the arm. D. Previous successful venipuncture on that arm. 17. When mentoring a new phlebotomy technician, what is the most effective feedback technique? A. Providing all feedback at the end of the training period. B. Immediate, specific feedback focusing on observable behaviors. C. General praise without specific details. D. Written feedback only with no verbal communication. 18. What is the proper procedure for collecting a blood culture specimen to minimize contamination? A. Clean site with alcohol only, then collect specimen. B. Clean site with soap and water, air dry, then collect. C. Clean site with antiseptic, chlorhexidine or iodine, allowed to dry completely, then collect. D. No special cleaning required, collect specimen immediately. 19. According to regulatory compliance standards, how often must phlebotomists complete continuing education to maintain NPA certification? A. 6 continuing education units CUs annually. B. 12 continuing education units every 2 years. C. 20 continuing education units CUs every 3 years. D. No continuing education required after initial certification. 20. What is the primary purpose of using a winged infusion set, butterfly needle, for venipuncture? A. To collect larger volumes of blood more quickly, to access small, fragile, or difficult veins. C. To reduce patient anxiety about needle size. D. To comply with infection control requirements. 21. When developing a phlebotomy skills competency assessment, which element is most critical for validity? A. Including only theoretical knowledge questions. B. Aligning assessment criteria with actual job performance standards. C. Making the assessment as difficult as possible. D. Using subjective evaluation without standardized criteria. 22. What is the correct method for labeling blood collection tubes? A. Pre-label tubes before patient identification. B. Label tubes at the nursing station after collection. C. Label tubes at the patient's bedside immediately after collection. D. Label tubes only if specifically requested by the laboratory. 23. Which communication technique is most effective when working with an anxious pediatric patient during blood collection? A. Using medical terminology to appear professional. B. Ignoring the child's concerns and working quickly. C. Using age-appropriate language and distraction techniques. D. Having only adults present without explaining the procedure. 24. What is the maximum time a blood specimen for glucose testing should be centrifuged and separated if collected in a tube without glycolytic inhibitor? A. Within 15 minutes of collection. B. Within 30 minutes of collection. C. Within 1 hour of collection. D. Within 2 hours of collection. 25. According to standard precautions, what personal protective equipment PPE is required for routine phlebotomy procedures? A. Gloves only. B. Gloves and face shield. C. Gloves, gown, and N95 respirator. D. Gloves and gown, face protection if splash risk. 26. What is the appropriate action if a phlebotomist accidentally contaminates the needle before venipuncture? A. Wipe the needle with alcohol and proceed. B. Discard the needle and equipment, obtain new supplies. C. Use the needle quickly before further contamination occurs. D. Ask the patient if they consent to using the contaminated needle. 27. In adult learning curriculum design, what is the recommended ratio of hands-on practice to didactic instruction for phlebotomy skills? A. 25% hands-on, 75% didactic. B. 50% hands-on, 50% didactic. C. 70% hands-on, 30% didactic. D. 90% hands-on, 10% didactic. 28. What is the primary reason for avoiding prolonged tourniquet application during venipuncture? A. Patient discomfort and anxiety. B. Hemoconcentration and altered test results. C. Increased risk of hematoma formation. D. Damage to the tourniquet material. 29. Which of the following is the correct sequence for performing a venipuncture procedure? A. Apply tourniquet, cleanse site, identify patient, insert needle. B. Identify patient, position arm, apply tourniquet, cleanse site, insert needle. C. Cleanse site, apply tourniquet, identify patient, insert needle. D. Insert needle, apply tourniquet, identify patient, cleanse site. 30. What is the appropriate needle angle for performing a capillary puncture? A. Perpendicular, 90 degrees to the skin surface. B. 45 degrees to the skin surface. C. 30 degrees to the skin surface. D. Parallel, nearly flat to the skin surface. 31. When evaluating phlebotomy program effectiveness, which outcome measure is most indicative of quality training? A. Number of students enrolled in the program. B. Pass rate on national certification examination. C. Length of the training program in weeks. D. Number of instructors employed.